Hi, everyone. Welcome to this session on moving from process-driven to data-driven government. Thanks for coming. I'm Aaliyah Sternstein, a senior correspondent at Government Executive and NextGov. I've been with the company since the start of the Obama administration and covered e-government before that at National Journal's Technology Daily before it shut down late 2007. Up until about a year ago, I covered IT management and data transparency. I now focus on cybersecurity and homeland security systems. And in just the last year, so much has changed in terms of IT management and data management. You know that data, big data, and mobile data are critical topics right now, which is why we're having this conversation. The amount of quantitative and qualitative information you are required to process on a daily basis is growing with every new technological advance. This wild amount of data is hugely helpful in planning, and it's great for obtaining valuable feedback instantly. But it can also be a huge time waster and demoralizing if used in the wrong way. We've all heard the concerns from the education community about having to teach to the test, concerns about irrelevant or impossible thresholds to meet. Data can enhance performance or it can stifle it. We're really lucky to have two experts from inside the government and one from the outside who's been looking in, who can help take data-driven government theory and show you how to put it into real-world practice. Help you handle the inflow of information, and perhaps even more importantly, train your employees to do the same. So on to the good part here. Mark Johnston, who is the Deputy Assistant Secretary for Special Needs at the Housing and Urban Development Department. He's been there for almost half a dozen years in that position. He's responsible for overseeing a $3.5 billion account that goes towards aiding the homeless and those at risk of becoming homeless, as well as people with HIV and AIDS. And he started in the federal government in 1983 as a presidential management intern. My understanding is that he works pretty closely with our second federal guest, and that's Susan Angell. And she's the director of the Homeless Veterans Initiative at the Veterans Affairs Department. VA Secretary Eric Shinseki has tasked the department with eliminating homelessness among veterans by 2015. She's the lead on that little project. She also, in the past, has volunteered for an assignment in Afghanistan, where where she was detailed to the Health and Human Services Department, and in that post, she taught the local Afghan staff how to administer and oversee the operation of a women's hospital. And our non-federal expert, Sampriti Ganguli, is a managing director at Corporate Executive Board. She is responsible for working with the United States and Canadian CIO, CFO, and Chief Human Capital Officer communities. Her bio states she currently assists federal agencies in their quest to become more efficient and harness analytical tools to make informed decisions. Sounds like you're in the wrong place, my dear. She's been at Corporate Executive Board for more than a decade. Full disclosure, Corporate Executive Board and Government Executive, both owned by the same person, David Bradley. And before Corporate Executive Board, she was at JP Morgan Chase, MCI WorldCom, the World Bank, and Deloitte Consulting. How we're going to kick this off is I would like Mark and Susan to address a question, and then Sampriti, if you would lend your insight. And this is, how do you decide which outcomes are worth measuring and prioritizing?
You'll start.
Okay. When you're deciding which outcomes to choose, certainly your administration and your leadership has a big part of that. So when the president and our secretary said we are going to end homelessness for veterans by 2015, that was our outcome measure. That's the place that we start. That's the place where we walk back. What is it we need to measure on our way to that particular outcome? Sometimes when you're deciding on measurements, you might start at the front end, but from this one, we started at what is the most important outcome, and that is a veteran and their family in a safe home, and walk back from that on what we're going to measure.
And what really informed the VA Secretary Shinseki and the Secretary of HUD in terms of saying we could actually reduce and end veteran homelessness was born out about 15 years ago by going, frankly, bottoms up. And we saw, for instance, even recently in the city of Seattle, that if you looked at the 95 chronically homeless persons that were expending the most amount of funds ricocheting through public systems, such as a local jail, the ER, other public institutions, those 95 men and women were costing the city of Seattle $8.2 million every year. And at the end of the year, they're still homeless, so there was no real solution to any of their situations. And so there was a focus to say we ought to be targeting our resources at HUD on the people that cost the most money. And so we've seen this across the country, in New York City and Seattle and all sorts of places in between. And we started to have a focus years ago on trying to focus on what we call the chronically homeless. Those are single persons with a disability that have particular periods of homelessness, either homeless for an entire year, that is 365 consecutive days, or homeless for at least 4 different episodes during a 3-year period. We started seeing reductions in chronic homelessness year after year. So that lesson learned by looking at some local data from a number of different cities really gave our 2 secretaries the confidence to say we could go beyond just reducing chronic homelessness to something much bigger, which was ending homelessness overall, and then bifurcating and saying let's focus on veterans and some other populations.
I think one of the things I would add to that is when we look more broadly at performance measures and outcome-based measures, as was discussed earlier, one of the most critical elements is that metrics need to be strategic, that is, linked to a very clear priority. 2 other elements I would add is metrics and outcome measures preferably should be predictive, that is to say that they can actually help you draw a conclusion about a potential outcome. And the third is that they need to be proactive. So is there a decision that we can make that will impact a forward outcome as opposed to many different measures that tend to be backward-looking in nature? Striking the right balance between historical kind of backward-looking measures but trying to invest in predictive measures are instrumental to helping agencies think about the right set of outcomes.
And that leads into the next question, which is how do you balance the requirements, the federal requirements for data-driven government right now to measure performance with the need to have more time to develop well-considered, enduring performance measures?
Let me jump in and throw out an observation. Back when the Government Performance Results Act was just enacted, I didn't know about it, and I was working in the Homeless Programs Office at HUD, and somebody came to our office from the research office saying, we've got this new statute, GPRA, and we need to be developing performance measures across government. And this was at 4 o'clock on a Thursday afternoon. And they said, so you need to develop the performance measures on homelessness for HUD. I said, that sounds really exciting. So what's the schedule here? Do we have like a year and a half, 2 years? And literally the answer was 5 o'clock. Like, are you serious? This is 4 o'clock. But that's how I think many agencies started off. When there was a statutory requirement through GPRA that you've got to do something, you start with whatever you've got. And literally for us it was to have a draft performance set of measures by 5 o'clock that afternoon. Now we got a lot more thoughtful after that, and we found we had to dig ourselves out of holes when you have such a short period of time. But we also found if you sit around waiting and worrying forever, you're never going to get anywhere. And so you do have to start. You look at the data you've got. You look at your experience that you've had in terms of running programs to see what are some reasonable measures based on what you're really trying to achieve. And that really is the key. if your goal is to end homelessness for a particular population, that's what you start with. And then identify the metrics you're already collecting to see how you can make an impact on that. And then you ask yourselves, going forward, what are the other measures we should be collecting that aren't? So we can start collecting that information annually and nationally so we can better inform how we're reducing the particular problem at hand.
And I think our journey was similar. Until Secretary Shinseki, we were counting, if you will, productivity. We were counting the number of rescues we had, the number of people that we could get into a domiciliary, or the number of people we could get into a grant and per diem program, and that was the measure of our success, that we were able to rescue folks from the streets, get them into programs that had treatment associated with them. What we found, and what Secretary Shinseki had us look at, was that ending homelessness, and it was not. It was helping people get off the street, but it wasn't ending homelessness because you were still homeless when you were in those programs. So we had to do a complete shift about how do we start measuring ending homelessness by counting the people that get to a real home. And we do that pretty clearly and pretty effectively with our HUD-VASH program. And if I take a moment just to describe
Please.
that, that's a partnership. HUD will put dollars out to the public housing authorities across the nation for Section 8 vouchers. And then what VA does, we assess individual veterans and their families for eligibility, refer them to the public housing authority, and then they end up in an apartment or a place that they're going to live that is their own, that is their permanent house. We do the case management and the supportive services that help them achieve stability and safety while staying in that house. That was ending homelessness, which was a very different paradigm.
And I want to emphasize how unique that is. I've worked in 3 different federal agencies over the last 29 years, and I've never seen or participated in a jointly administered program where 2 different federal agencies are actually running a single program. And it certainly helps with the alignment when you're hooked to the hip. I mean, we talk every day or email every day trying to make sure we have things in alignment with this particular program, the HUD VA Supportive Housing Program, but other initiatives that we've got. And I think one other observation I'd like to make in terms of outcomes, because this is a very outcome-focused program where we're seeing people ending their homelessness. They've been on the streets typically for months or years, and now they're literally living in their own apartment. I know for years, outputs was almost a dirty word, and you had to have outcomes, and outcomes was where it had to be. And I have certainly come to appreciate over the years that they're both incredibly vital. So let me give an example of an output that I find very, very useful when we've been trying to end homelessness by having somebody no longer be on the streets or in shelter, which is a great outcome. One of the only ways for HUD to get there was to better use its funds. So we started looking at how we're spending our dollars. We have about $2 billion a year that we can use to ending homelessness for a whole array of activities, from street outreach, daycare, drug treatment, mental health treatment, life skills, as well as a bunch of housing activities, for instance, paying the rent. What we found was we had a laissez-faire approach to confronting homelessness and said to communities, use our money however you see fit locally. And what we found was the communities couldn't find the services anywhere. For instance, going to the Department of Health and Human Services was a very big challenge. There wasn't a dedicated pot of money of flexible funds for homelessness at that department. And so they'd come to HUD. And so about 60% of HUD's funds for homelessness was going to things like daycare and drug treatment and mental health treatment, things that we're really not the experts on. And it was really stymieing us in using our resources for what we're really good at, which is providing and developing housing. So we built in an incentive into a national competition to say, if you use our funds more for housing and less for services, we will give you more money. And that was a giant shock to the homeless system across the country. And every year we would inform people, this is how we're going to do it, that a portion of our funds are going to be dedicated to getting you using our money more for housing and less for services. You can decide how you want to do it. And they saw where the money was, and they really focused their attention on finding other resources for the services, different HHS programs, or VA programs or labor programs or local programs. We didn't really care where the money came from as long as we could use more of our money on the housing side. And so today, less than a third of our, about a third frankly, it's about 33, 34% of our funds are used for services, but the rest of it is used for housing. And because of that shift over time, we've created tens of thousands of additional housing units with the same level of funding. It was just used for different purposes. So that for us was a very powerful output that in the end resulted in great outcomes by having more housing to end homelessness with.
One thing I would just add, as I look across a lot of federal agencies, there is a proliferation of metrics. There are policy measures, there are management measures, there are statutory requirements, there are management reports, and I think it's important across agencies to be able to distinguish very clearly which metrics are used for which purpose. When we look across organizations, we typically think of 5 characteristics of what would be sort of a best-in-class metric. The first is it's precise. So there's no room for ambiguity. The second is it's clearly defined. All users that are evaluating this metric or looking at it know exactly what it means, and most importantly, they're measuring it in exactly the same way or in a very similar way. The third is they're articulated in the user's language. So not how we view the world, but the people that are going to be consuming the metric. Do they easily understand what this measure actually is? Can they actually relate to it? And when you talk about very large agencies, is do they see themselves, does the individual see themselves potentially as being able to influence that outcome by a decision he or she chooses to make or not make in their agency? The fourth is, are they actionable? That is to say, can we actually make a decision based on the trend line that we're seeing in this particular metric or this measure? And then finally, are they stakeholder relevant? So we know that we need to tailor our measures to different audiences. Are we presenting the right set of measures to the right audience when we're actually collecting it and when we're presenting it?
And I should mention, some of this research was recently published in a Harvard Business Review article. She's going to get more into that towards the end of the discussion. And I also want to mention that these two were named this morning as finalists in the Service to America Awards program. They are one of 33 out of 400 people nominated. There will be 9 medalists. And what they won for was decreasing homelessness among veterans by 12% in 1 year. Congratulations. And so, you two, how do you align leaders, managers, and staff when you're sometimes working across agencies to assess performance and make needed course corrections, as you said, when you figure out that perhaps the metrics aren't spot on?
You want to start?
Sure. Well, when you're talking about alignment, we're actually aligned at the highest level. We each have agency priority goals, and we share too. So both of our secretaries answer to those agency priority goals. One of them is to house 12,200 veterans in a year. And the other one is to bring the point-in-time count when we go out into every community and count the number of homeless to include veterans, that we bring that down. This year, I believe it's 59,000 from last year. So those are huge, huge goals, and we as agencies are joined at the hip with those agency priority goals. How do we track that? We have, HUD has a process, and I'm going to let you talk about that and talk about how it's impacted us, called HUD Stats.
Okay. So you've heard of CityStat, probably, and other stat derivatives. Our secretary is very, very performance focused, and he helped run housing programs for the city of New York for a number of years and brought that with him. He was doing it in New York City. And we decided to do HUD Stats for the various priority goals at HUD, and 3 of the 7 priority goals at HUD are homeless-related goals. So I'm very involved in that process. And we have one on veterans. And so with veterans, we thought, well, let's invite the VA. Let's have them see how this works. And then we realized, well, they should be here as actual key members of the HUD Stat for veterans and ending veteran homelessness. And so the Secretary of HUD and the Deputy Secretary of VA are the ones that convene the HUD Stat. And we have the key people there. We're peers at our agencies. We have our staff that are key there. And these are, you know, as in most any federal agency, you don't have all the resources just in one particular area of your agency. And so we have a number of pots in HUD and in the VA. And so we're all there addressing these. And I was in a meeting recently in a HUD stat about a week and a half ago where we were looking at veteran homelessness, family homelessness, and chronic homelessness overall, just to kind of reassess where we're at. And we were trying to figure out how we could better measure homelessness among a certain entity out there, public housing agencies, and realized we've got to have a more precise definition, to your point, so that we can measure consistently across every single city and county in America. And we had this very hearty discussion with program staff, with researchers. The general counsel was there, the secretary, the deputy secretary, the chief of staff, the COO, everybody was there, frankly, and had this candid, open conversation about how we should do this. And it was great because you have everybody in the room that needs to be there to make an informed decision. So staff had done the prep work in terms of knowing what the recommendation should be, and then we had a very candid conversation with our secretary in particular about how we get there, and made the decision in the room, and now all parts of HUD are getting aligned on how to implement this across their various programs. So I really can't understate how valuable we've experienced this HUD stat approach to be, where you can tee up key decisions in a meeting, have informed decision, have informed conversation, and actually come out of a meeting, maybe a 2 or 3 hour meeting, with some very concrete decisions that we can jointly implement across our various agencies.
And I think the way this impacted VA, we were able to go to HUD with a slightly different paradigm in how we look at performance. We had an area that had a high need in terms of the number of homeless veterans, but poor performance. So as a team, VA and HUD leadership went to that community. We met with each other's staff on an individual basis. We then had a collaborative meeting where there were three parts to the braid, if you will. There was the VA part, the PHA part, and then the veteran part in terms of getting someone from assessment to a home. And each learned from the other what were the sticking points? Why did it take so many days for the assessment to occur? Why did it take so much time in the PHA to get a voucher out there? And what was keeping the veteran from actually getting into a home, which was the end result? It was quite illuminating to figure out when there's a lack of communication sometimes between leadership in DC and the field, how self-imposed rules come up. And I think we were able, from a policy perspective, right then and there to help people say, you know what, you think you have to do that, but you really don't. An example would be project-based vouchers. The community was really, really wanting project-based vouchers, but they didn't think that they could do it. The VA was very much in support of it. And because the HUD leadership was there, they could say, you can do it. Here's your mechanism. So right then and there, we could cut out in a process several days, and every single day that it takes for a process to be completed, that's the day that veteran is on the street. So we were able to look at each agency's process. Sometimes we were doing the same thing over, so we were able to cut some of those steps out, and we've been able to really get some nice improvement in that area. But that, to me, the jewel of the whole process was when we actually have the HUD stat meeting. It's the top leadership at the secretarial level, at the assistant and deputy assistant secretarial level. Anybody who has a role to play, whether it's IT or HR, is in the room in DC, and we connect with the field in terms of their issues. So a field person actually can speak to the secretary and say, here's what we're finding, here's the policy relief we need, or here's how we would like to readjust our process. So it's a very top to field where the action is process, and we learn a lot from each other. We also compare cities in that process. So one city might have solved problem A, they pass it on to city B, and there's that exchange there, so everybody doesn't have to start from zero. But what that requires at the bottom level, and I think HUD and VA have been able to do this, I'm not sure how far spread this is, was the level of trust and transparency. We had to put our non-performance or low performance up on a screen for all to see and for all to take responsibility for. So it wasn't a scrubbed discussion. It wasn't a scrubbed presentation. It is what it is. We use the data, and from the data, it really helped us decide what kinds of changes we need to do, and I think brought the agencies closer together and aligned in the goal.
And I'll just mention, just to emphasize that excellent point at the end, after our first HUD stat, I was with our secretary going to a meeting, and I said, so what did you think? And he goes, I thought it was great, but I can't stand dog and pony shows. So make sure that going forward, we don't have a HUD stat where there aren't real issues that we actually have to resolve. He doesn't want just a good story told. He wants to actually go to where the challenges are and the problems are, and that's the whole point of the meeting. It's not to look good.
In full disclosure, we featured HUDStat as a best practice a couple of years ago for all of the reasons mentioned, but particularly because of its ability to work across multiple agencies and because of the way in which policy and management essentially can overlap with a process like HUDStat in a resource-constrained environment, which is what a lot of federal agencies are looking at in the kind of short to medium term. These kinds of data-driven decision-making really has the ability to help accelerate the right amount of resource allocation when agency leadership are having to make difficult trade-offs. The other thing that was interesting about the HUDStat process and all of the stats more broadly is this concept of democratized decision-making as a result of data, and this concept of essentially allowing problems to be discussed in kind of a free and open forum. This is a major cultural shift, quite frankly, that we're seeing across a lot of different agencies when many kind of play the dance around not releasing information, being careful about information, scrubbing data, holding back on data. And I think, if I were to predict, that this will be a longer-term shift, but that shift is definitely coming. You can see that already in the way that a lot of data have become publicly available. And even in the management realm, if you're looking for basic measures around IT spend in government, around the number of people that work at the agency, how much they actually make, all of the data are actually publicly available through a lot of the information your agencies make available. And as a research organization, there's lots of fertile ground to be able to do much more quicker analysis as a result of these initiatives.
Okay, so let's take the contrarian viewpoint. How much is too much? How do you know when the data isn't serving its purpose? It might even be hurting, detracting from the mission. And Sampriti, I want you to discuss this because you had some interesting findings when you did survey CIOs, I believe. So how do you prevent personnel from getting lost in the clutter and misinterpreting the information?
Yeah, we actually did a study of 5,000 knowledge workers, essentially people that use IT for a lot of kind of the 8 hours or the 10 hours a day that they're actually working. And unsurprisingly, government workers are disproportionately knowledge workers. They are in the business of analysis and data gathering and data requirements. And what we found, which was a little bit startling, is that big data actually makes what we call the insight deficit, that is, the ability to draw conclusions from data, worse. So knowledge workers surveyed, basically 40% of them said they did not have the adequate skills and the adequate training to be able to effectively use that data. So as we're making data more available, we're actually making it harder potentially for knowledge workers to draw conclusions. So what is it that they actually need to do? What matters? Well, what we found is agencies and organizations that create what we called informed skeptics, that is to say people that rely on data but also use judgment to temper what the data say to draw their conclusions, are the ones that are most successful in bridging this insight deficit. So the question for agencies is essentially, how do we encourage and foster the use of judgment and the articulation of that judgment in these open forums and settings by which we can draw the right conclusions what we want from our agency. And if you think about it, this is rife across government. If you think about the intel agencies, law enforcement agencies, they're in the day-to-day business of trying to draw conclusions from disparate, discrete, disconnected data sets, and they do so quite successfully. Unfortunately, we tend to read about it only when it goes wrong, but more often than not, it actually goes right. And there's a huge amount of implicit and tacit knowledge already within agencies where I think that that can be tapped into. The second thing that we found in our research was pretty interesting is this notion of big judgment can actually be taught. That is to say, it's not something that is inherent or intrinsic in people that we're hiring. Many agencies and many organizations, because of this massive amounts of data, are going out and they're trying to hire people with very strong quantitative skills, people that have the ability to really amass and synthesize a lot of that information. And quantitative skills are great. They're necessary, but not a sufficient condition to being successful in analyzing data. As it turns out, coaching, the ability to actually train someone and teach someone to do analysis is far more important than just pure quantitative skills. So a couple of thoughts on that front, which is hire people who not just have quantitative skills, but that can actually coach. That is to say, spread this notion of how you take analysis more broadly across the agencies. And secondly, think about the analysis and the training that is required for the staff who are now in charge of big data. Third, look across agencies. My sense is some of the very best organizations that use judgment, that can draw together disparate big data assets, actually reside right here in the federal government.
Do you have something you want to add to, I mean, anything corroborating or perhaps discounting what she's just said?
Do you want to start? Or?
Sure. It's interesting because I think we had a challenge that we're grappling with right now that almost goes to counterintuitive. Intuitively, you think you should be going down this road, and then we learned, you know what, even though this is counterintuitive, the data is telling us this is actually better. And an example of that would be our Housing First. Intuitively, we at VA felt it was important to get someone through a treatment program before we get them into housing. Let's get their substance abuse under control. Let's get their mental health conditions under control before we, help them get that key and that lease, because we just didn't know what would happen with that key and that lease, and we didn't think it would end up in a very good place. But Washington and New York, I did some very interesting Housing First projects that informed us the folks that best use those kinds of services are your chronically mentally ill. And so, as counterintuitive as that was, the data shows that we should be trying to house our chronically mentally ill first. And we have a research project that we're doing jointly together. As we were looking at folks that, in HUD-STAT, we were looking at the attrition rate. And it looked like our veterans had a little bit higher attrition rate once they were housed than the non-veteran population. So we're doing a study together, and some of the preliminary data is showing that the most successful users of the HUD-VASH program, and combining that with Housing First, are our chronically mentally ill and our veterans with children. So that's where the intuition wouldn't quite lead you down the road, but once you got the data, you could go down that road a little bit more confidently.
Let me make one observation that's related to that. It's a very good point. On Housing First, the first empirical study that was done on it confirmed what many local groups had found, which was that if you have a severely mentally ill, chronically homeless person out on the streets, and you move them immediately into housing without going through the treatment approaches that Susan referred to, a year later, 12 months later, 84% of those folks are still in their unit. So that was nice to confirm that, but what we found by really looking at the data very, very carefully was that 44% of them had actually fallen out of the housing during the 12 months. They had fallen back into jail, gone to the emergency rooms and the shelters, et cetera, but it was great services, case managers going and finding them in the hospitals and the jails, helping them get out and back into their housing that was the real success. So if we had just looked at the basic high-level data, which was that 84% were retained in housing a year later, we would have missed the bigger point, I think, which was if you don't have a great service package connected to the housing, you'd have a disaster on your hands.
Is there anything else you want to add about their observations?
No, I think that's fair. This notion of uncovering what is the underlying driver of an outcome, I think, is really important. And the analogy I'll draw is from a very common metric that a lot of organizations use, which is customer satisfaction. Everybody believes customer satisfaction is good. Customer satisfaction is good. It's actually a great metric. Interestingly enough, it's not always predictive of what a lot of companies want, which is repeat purchases. So just because a customer is satisfied doesn't necessarily actually mean they're going to buy again. And once you actually begin to unpack a lot of this research, you find, especially in the call center area, something called first call resolution. That is to say, was my question answered the first time I called in, matters a lot more to repeat purchases than does customer satisfaction. If you look across, and we are all people that receive customer satisfaction surveys, there's a tremendous amount of time and energy that's being spent to collect data. That is valuable data, but it doesn't necessarily lead us to the outcome for which we are looking. So this concept of uncovering the drivers behind metrics and really understanding what behavior we are trying to influence. As we have access to more data, we have the ability to more clearly inform our decisions around those types of drivers. And I think that's a great example of how that works.
You know, that's a great point. I wanted to actually jump on, and then I'm going to defer to Susan on something. We would love to prevent homelessness. I mean, who wants to wait for somebody to become homeless to help them? And so we've been running a program for the last 3 years to do that, to prevent homelessness so that you can catch them while they're still housed, provide the rent, provide the utilities, whatever they need to stay in the housing rather than fall on the streets. Because when you fall into homelessness, it can be a very expensive enterprise. As I mentioned, it can easily cost $48,000, $40,000 a year. So we've been running a program doing two different things: homelessness prevention, where we're providing the rent, the utilities, whatever it takes to help somebody stay in their current unit. We've also been doing something called rapid rehousing, which is if they do fall into homelessness, let's use those same interventions, providing the rent, finding them a unit and getting them in that unit and helping them stay there. And what we found, based on a wonderful New York study, was that it's really hard, it's frankly virtually impossible at this point in time to accurately predict homelessness. They found that, and they tracked dozens and dozens of factors for thousands of people over time. And they found, for instance, even if you have the highest risk factors they could find, 66% of the time, 2 out of 3 times, those people, the people that you would say have got to become homeless, did not become homeless. They're so tenacious about not becoming homeless, who wants to be on the streets, right, that they find ways to prevent their own homelessness. And therefore, we don't want to, frankly, commit a whole lot of resources on preventing homelessness when we're going to be wrong at least 2/3 of the time. So what we did as we're running this program is sharing all the insights we're gaining with the VA. So they could be informed with that, because we're both starting up new programs. For us, we've got a program called Emergency Solutions Grants, which is really tailored to do prevention and rapid rehousing. So our secretary, in a YouTube video, said to all of our grantees, based on the research, please do not commit your resources on the prevention side. Please commit it to rapid rehousing, where you have an amazing success rate. The success rate there is 90%. Some cities even better. Philadelphia, for instance, is about a 96% success rate, where if somebody's homeless, you put them in this rapid rehousing program, they do not revert back into homelessness. And I'll turn over to VA in terms of their experience with this information.
So since we're working so closely together, we took those lessons learned from the HPRP dollars, and we have a new program called Supportive Services for Veterans and Their Families. Because their project was so successful and rapid rehousing was the key. We made our allocation of dollars, and we decided how we were going to spend those dollars based on their lessons learned, rather than us having to go for 3 years and do the same thing, or maybe make, you know, the same decisions and not having the outcomes that we want. We could cut through that and say, okay, the two things that are critically important is rapid rehousing, and what Mark referred to earlier was the case management. That case management is so critically important for success. So our first attempt out there with a brand new program already incorporated the lessons learned from HUD's HPRP program. So we put out $60 million last year, and this is a program that we're also able to help families, which was critical for us because as an agency, we had the authority to help the veteran, and that was a barrier because many of our veterans came with families, particularly our women veterans. So using those lessons learned, we were also able to help them through the SSVF grants, and we have another whole round of them that'll be going out this summer.
Okay, now we're going to open up the session to questions from the audience. I would ask if you could introduce yourselves, state your name and what organization you're from before you ask your question. She's got a microphone coming for you.
Hi, I'm Lorene Daly with the Department of Homeland Security, and I wanted to ask you about the empirical evidence that you started with. You said that in Seattle you had a certain number of homeless who were using, I think it was $8.2 million.
Yep.
How many of those were veterans? And then you had evidence for Seattle. Did you do an accounting across the country? Did you do a survey, or did you have evidence across the country before you started the program? So
many of them are veterans. I don't recall what the exact percentage is. About a third of single homeless persons on the streets are veterans. And this set of findings is consistent across the country. The dollar figure varies. In Seattle, the median cost was $49,000 a person. But we've looked at rural places. Rural Maine, for instance, has very high costs. New York City, even 13 years ago, was costing $40,000 a person. So there are dozens of these individual studies done out there. We've not done a national one, which is probably something we should do if we can find some research dollars, but we have aggregated the local studies that have been published and have been touted to learn lessons from there. Salt Lake City, for instance, did one where they were tracking the cost of arresting somebody who's homeless because they're drunk. And it's an enormous cost, and what you'd find is it's the same person getting arrested over and over and over again. So you waste a tremendous amount of resources on the Salt Lake City Police Department that you could alleviate if you'd actually target that population. And so Salt Lake City actually has a bifurcated approach. If you're chronically homeless, they will dedicate huge amounts of dollars to permanent housing so they can come off the streets and stay off the streets. And for people that are not chronically homeless, they dedicated a significant percentage of the resources they got from HUD for rapid rehousing and not for prevention. So Salt Lake City is one of those places where every year their chronic homeless numbers go down because they're incredibly strategic on how they use their resources based on the data that they've got.
Anyone else? Okay. I would like each of you to, perhaps within a minute, give them one lasting message that they can take back to their agencies.
Well,
or you can just share an experience.
I'm just trying to think what it would be.
Yeah.
I guess for me, when I look at an issue like homelessness, these are the poorest of the poor in America. There's nobody that has more needs than a homeless person, who are typically severely mentally ill, typically have an active substance abuse problem, will often have HIV/AIDS, did not graduate from high school, has a very dysfunctional family, lots and lots of challenges that with a targeted, intelligent approach based on data, knowing the actual costs associated with it, knowing the actual interventions that actually work for that population, if you can reduce chronic homelessness in this country, you can solve any social problem that's out there. And that's the thing that's really overwhelmed me, is that if you're focused and targeted on your issue, whatever and how seemingly overwhelming that issue is, you can absolutely solve it.
Well, I have the same appreciation for I think all the things that we've discovered and learned about ending homelessness. To me, the power of government coming together has been very illuminating and very inspiring. We go to a meeting frequently with the Interagency Council on Homelessness, which has 19 federal agencies as members, and to be able to work on the problem without the stovepipes and with the expectation that I can bring my bag of shells to the table and HUD can bring their bag of shells to the table, and we try to weed out what's duplicative and make sure that we stay on mission, stay on point, and we use our resources in a very smart and strategic way. To me, that has been the lesson learned as we work together as agencies, that it's not a singular agency that can solve it, but together, strategically, thoughtfully, and looking at data, being transparent about the data, and being able to work the problems together with the field that actually has to execute. That's what my big takeaway with this project is.
Thank you. Thank you.
My advice is don't let perfection for the quest for the right metric be the enemy of the good. And in our opinion, the power of big data is it should enable faster decision making, and to the extent that it doesn't, maybe a little bit of a step back to say, are we in fact now in search of so perfect of a measure that we're unwilling or unable to make decisions off of the vast amounts of data we now have? So how do we think about, again, that right balance of intuition and data to help direct agency leadership towards the right set of decisions? That's probably the biggest challenge and the biggest opportunity ahead for federal agencies as they sit upon increasingly larger and larger data assets.
Thank you. Thank you, Mark, Susan, Sampriti, for taking time out of your day and for helping our audience. And thank you guys for attending. Have a great day.